Okay, now it's time for type 4 hypersensitivity reaction, which is delayed and which is T-cell mediated. Type 4 hypersensitivity is T-cell mediated, and type 4 hypersensitivity is delayed and does not involve antibodies. This is two key points about type 4. Okay, type 1, 2, and 3 are antibody mediated and type 4 is not. No IgE, no IgG, no immune complexes, no complement driven primary mechanism. So when we think about type 4, we think about T cells, delayed, no antibodies. This is the foundation. Okay, type 4 hypersensitivity is entirely driven by T cells. This is why it is also called delayed type hypersensitivity. Why is it delayed? Because T cell responses take time. The immune system must recognize antigen, activate T cells, proliferate and differentiate, release cytokines, recruit other immune cells, and then cause tissue injury. So this process is not immediate. It typically develops over hours to days, classically 48 to 72 hours in many exam questions. So type 4 hypersensitivity has two major mechanisms and both involve T cells. We need to understand both clearly. Number one is direct cell cytotoxicity by CD8 positive T cells. So in this mechanism, CD8 positive cytotoxic T cells directly kill target cells. Why CD8 positive? Because CD8 positive T cells recognize antigen presented on MHC class 1, and their job in the immune system is to kill infected or abnormal cells. So in this version of type 4, antigen is presented on MHC class 1. CD8 positive T cells recognize it. They release perforin and granzymes. Target cells undergo apoptosis. This is direct cell killing. When we see T cells directly killing host cells and it is not antibody mediated, we should think type 4 direct cytotoxic mechanism. Another mechanism is inflammatory reaction by CD4 positive T cells. The second mechanism involves CD4 positive effector T cells. Here's the sequence. CD4 positive T cells recognize antigen. They release cytokines. Cytokines recruit and activate macrophages. And then macrophages cause tissue damage. This is the classic delayed type hypersensitivity pattern. Instead of directly killing cells, CD4 positive T cells coordinate inflammation. This often produces macrophage-rich inflammation, induration, and tissue swelling. So, when we see macrophages, cytokines, induration, delayed inflammatory reaction, we think type 4, CD4 mediated inflammatory mechanism. Remember, there is no antibodies involved. In type 4, does not involve antibodies, does not involve immune complexes, and is not complement driven. So if a question mentions IgE, IgG, or IgM, complement consumption, or immune complex deposition, that is definitely not type 4. Type 4 is purely T cell mediated. Let's go through some classic examples and explain why each type is type 4. Okay, number one, contact dermatitis by poison ivy or nickel. This is a delayed T cell mediated skin reaction. It is not histamine driven like type 1 allergy. The rash appears hours to days later, often worsening over 48 to 72 hours. This is a CD4 mediated inflammatory reaction. Next one is drug reaction with eosinophilia and systemic symptoms. DRESS, D-R-E-S-S, DRESS. Drug reaction with eosinophilia and systemic symptoms. This is a delayed T-cell mediated systemic drug reaction. It can occur weeks after starting on medication and it involves widespread inflammation, eosinophilia, and organ involvement. This is not immediate allergy. This is T-cell driven inflammation. Another one is graft versus host disease. Graft versus host disease, in this graft versus host disease, donor T cells attack recipient tissues. This is classic T cell mediated injury. It often involves skin rash, diarrhea, liver dysfunction. And mechanistically, both CD8 direct killing and CD4 cytokine mediated inflammation can occur. Let's talk about the tests that demonstrate type 4. PPD for TB infection. What is PPD? PPD is purified protein derivative, TB proteins, injected intradermally just under the skin. So it is the tuberculin skin test, also called the Mantoux test. If someone has been exposed to Mycobacterium tuberculosis, they have memory cells that react. The reaction is type 4 hypersensitivity, delayed T cell mediated. T helper 1 CD4 positive T cells release cytokines that leads to macrophage recruitment. So we read it at 48 to 72 hours and measure the induration, which is the firm swelling. A positive PPD suggests TB infection or prior exposure, including sometimes after BCG vaccination, but it does not by itself prove active TB disease. Another test that demonstrates type 4 hypersensitivity is patch test for contact dermatitis. Small amounts of allergen are applied to the skin. We check for reaction after 48 to 72 hours. Again, it is delayed T cell mediated and macrophage driven inflammation. Another test is Candida skin test. This evaluates T cell immune function. If the immune system cannot mount a delayed reaction, this suggests impaired T cell function. So the memory hook for type 4 hypersensitivity is 4 T's: T cells, transplant rejections, TB skin test, and touching contact dermatitis. And the phrase fourth type last to appear because it's delayed. Let's walk through common patterns and identify the dominant mechanism. PPD placed, induration appears 2 days later. So the mechanism is CD4 positive cytokines activating macrophages. This is the inflammatory arm of type 4. Another case, poison ivy, rash appears next day, worsens over 48 hours. Mechanism is CD4 mediated inflammation, delayed contact dermatitis. Next one, bone marrow transplant. There is rash, diarrhea, liver injury, and donor T cells attacking the host. Mechanism is direct cytotoxicity, CD8 plus CD4 inflammation, often tested as T cell cytotoxic injury. Next one, viral hepatitis. Lymphocytes directly killing infected hepatocytes via MHC class 1. Mechanism is CD8 positive cytotoxic T cells, direct cell cytotoxicity arm. Nickel patch test. Positive after 2 days. Mechanism is CD4 inflammatory reaction. Next one, DRASH syndrome. Weeks after medication. Mechanism is T cell mediated systemic inflammatory reaction. Although we talked about CD8 arms and CD4 arm, actually in real life many CD4 reactions involve both arms. CD8 positive direct cytotoxicity and also CD4 positive cytokine mediated inflammation. For example, acute cellular transplant rejection, graft versus host disease, or some contact dermatitis reactions. Biologically, both mechanisms can overlap. But on exams, we are usually asked to identify the dominant mechanisms. So if we see MHC1 CD8 killing, think cytotoxic arm. If we see macrophage rich inflammation, think CD4 inflammatory arm. Okay, that's it for type 4 hypersensitivity. Have a very good day and good luck.